American healthcare is complicated. We have what is called a multi-payer system, in which money goes from different sources to hospitals and other health services. You may get your insurance through a private insurance plan, like most people do, or maybe it's through a government program like Medicare or Medicaid. These are the multiple payers. Most people don't like the American healthcare system, with 61% saying that it has major problems or is in crisis. So some are proposing a radical idea, replacing the multi-payer system with a single-payer system. In this system, the government would be the single insurer and would use taxpayer dollars to cover everyone. All money would flow from the government to hospitals and other health services, who will still be privately owned. And it's actually quite popular.
I think we will pass a Medicare for all single-payer system.
They would continue to pay. They would just pay the federal government more in taxes so that the federal government in turn could provide health insurance.
So if then we step onto the same boat as Canada or onto the universal health care, all government provided, God forbid, like England, then I think you'll see the medical innovation dry up, and then that won't be good for the health of anyone.
America spends a lot on healthcare. Like a lot. Like more than double the average OECD nation and around twice as much as comparable countries like Canada or France. And we usually have comparable or worse health outcomes. Life expectancy is low. Infant mortality is high. And the rate of avoidable deaths is also high. Much of the US healthcare money doesn't even go to care. The US spends around a third of its healthcare money on administrative costs like billing and accounting. That's around twice as much as Canada, a country with publicly funded health insurance. There are a few reasons for this. The money comes from a lot of different sources, so hospitals must send different bills to many different insurers. That's a lot of work for the hospitals. Hospitals also have to keep records of what they give patients so they can be charged for the items. They also must do hospital management and keep medical records of patients. Insurance companies also often pay different prices for the same procedures, which again creates more complication and more administrative costs. And even with all of these costs, more than 40% of American adults are inadequately insured. So what proponents of single payer say is that we can simplify this by making all the money come from one source, and that it will remove a lot of the administrative costs that come with a complicated health insurance system. Another argument is that the government will be a lot better of a negotiator, especially with pharmaceutical companies. If the government is the only insurer buying drugs, they can set the prices basically anywhere they want to. If pharmaceutical companies don't sell for that price, they won't have anyone to sell to. They can also pass laws to force pharmaceutical companies to sell for specific prices. This makes the government a very good negotiator, and it's visible in countries with single payer or more government regulation of the healthcare industry. This is a study of drug prices in the US compared to 11 other countries. On average, they found that the US drug prices were nearly 4 times higher than these other countries. US residents on average spent twice as much on pharmaceutical drugs than the other countries studied. Japan was the cheapest country, paying only 15% of what Americans pay for drugs. Of course, you don't want to set the prices so low that it stifles innovation, but that is a balance you have to find. A common criticism is that it will take away choice of doctors and hospitals from the consumer and put it into the hands of the government. And it's true that single-payer plans will give the government the option to pick and choose what they will cover and what they won't cover. But it might give more choice for choosing doctors and hospitals by eliminating networks. A network is the doctors and hospitals in your insurance plan. If you choose a doctor outside your network, your insurance won't pay the bill. If a single payer system is established, all doctors will be in your network. Then there is of course the problem of cost. The US would have to raise a lot of money in taxes. We will need to raise enough money to cover some 330 million people, and it won't be cheap. Some of these costs will be offset by the fact that administrative costs go down and the fact that the government will be a good negotiator. You would also be able to redirect the money currently going to Medicare and Medicaid to this new single-payer program. A single-payer system would also get rid of premiums currently paid to health insurance companies, and some single-payer plans, like Bernie Sanders' Medicare for All, will get rid of all out-of-pocket spending, which may balance out the cost of new taxes for families. But if the government doesn't raise enough taxes, you have a system where doctors won't be able to spend as much time with patients as is necessary, wait lines become longer, and the quality of care drops. Vermont actually tried to create the first state single-payer program in 2011, and they actually found that Vermont's total healthcare spending would go down over 5 years and lower costs for nearly all of Vermont's families. But the plan was abandoned in 2014 because they were not able to get enough support for the necessary tax increases, despite the fact that they would save money in the long run. Usually, in a single-payer system, there is still room for limited supplemental private insurance to cover possible co-pays and things the government doesn't cover in their single-payer insurance. These plans are sometimes required to run as non-profits and are a lot cheaper than US private insurance, since the single-payer system covers the cost of most healthcare needs. This was the first part in our series where we want to look at healthcare. In the future, we want to look at other healthcare proposals like a public option or healthcare programs like Medicaid. We also quickly want to say that Congress have introduced a new version of a $15 minimum wage since the making of our last video on the topic. We have provided more details in the description of that video. Thank you for watching, and we hope to see you another time.